Well, good morning. As always, I'd like to start by recognizing more of our team members for receiving outstanding grant and research awards. In the past 2 weeks, we've received notice of awards for Ms. Frame, Mr. Kemp, another award for Dr. Altman, a co-award for Dr. Haruta and Ms. Donovan, and I'm really pleased to recognize that Dr. Fleming received an NIH R01 Research Award. Congratulations to all of them and to all of our outstanding researchers for continuing to contribute to science and to have their work recognized by their peers through the award of these dollars to support their work. An update on COVID. Our COVID team shared with me this morning that we currently have no new confirmed positive cases since the last time I spoke with you, and no students are remaining in quarantine at this time. We do have 2 students with symptoms who are being worked up. One of those has not been on campus as it's a 3rd-year medical student. And we do have 1 student who also has not been on campus, but had an exposure and is being evaluated. Overall, the large number of students that were being conservative placed onto quarantine have been returned, and only 1 of those was noted to have a positivity and has now been brought off isolation. The governor has asked higher education to begin asymptomatic screening. He is asking that at least 3% of at-risk populations on campus be screened to determine whether or not they may carry a virus. This includes faculty, staff, and students. We are working out the logistics on how to begin this testing and consulting with the Portage County Health Department on implementation. This is random testing, and those selected would receive notification if they're asked to come in and provide a sample. This is not surveillance testing to look at total numbers of populations that may have a disease, and this is not testing of symptomatic individuals. This is an attempt to understand if there are individuals who carry it, who are asymptomatic, who could be pulled from the population to be placed into quarantine. We are working carefully with the state and with the county health department to determine its implementation process, and you'll receive more information on this as it continues to unfold. Now, this is a wonderful time for me to give you an update, as I arrived at Neomed approximately 1 year ago today. In fact, this week it will be 1 year. And I arrived to an incredibly warm welcome, and I want to thank all of you for that welcome. It's been quite an interesting year, to say the least. Within my first 6 weeks, we received results from the LCME accreditation site visit. I received the faculty retention and climate survey results that had been conducted about 6 months earlier. And I received news that the health benefits budget had been overspent by about $1.5 million. All of these highlighted the work we needed to do as an organization. Approximately 5 months into my first year, we were hit with the pandemic. It came with a need to completely change the way we operate as a university in both education and in research. It also came with significant economic impact that resulted in millions of dollars of revenue losses for the university. These came from both services that we offer at the university, as well as through state share of instruction reductions. With your help and support, we implemented changes to allow us to weather the storm. This has been a very difficult time for universities across the country. The Chronicles of Higher Education reports there have been more than 50,000 layoffs and furloughs in higher education, and many or more are still expected on the horizon. But with your assistance, we have managed to weather that storm. And barring any other significant changes, which we may not have control over, the university will continue to function and operate at a high level, really because of the work that you have done. Shortly after my arrival, I learned that the LCME had some concerns on our last accreditation visit. They highlighted areas that needed attention, including our diversity programs, our educational support resources, our responsiveness to student feedback, and student perceptions of their educational experience. These findings came with a continued accreditation, but with warning of probation, as all of you know. I know that these issues predate our current College of Medicine leadership team. In fact, the results would have been worse had it not been for the great work of Dr. Young and her team trying to fix and correct any problems prior to that first site visit. We continue to have good outcomes at that time with National Board of Medical Examiners Step 1 and Step 2 exams relative to our national peers. And we've been very successful in matching our students into outstanding residency programs. So it wasn't the quality of our programs that were being highlighted. It was really about how we operate, respond, and resource these educational programs that were noted to be problematic. We have worked closely with the Liaison Committee for Medical Education Secretariat and have rebuilt our educational teams and our support structure. And we're feeling confident that we're in a strong position with regards to accreditation, and we are looking forward to our limited LCME virtual site visit in February of 2021. As part of the process of revising and re-envisioning our College of Medicine educational programs, we have launched an entirely new curriculum. It is a cutting-edge approach to medical education that leverages peer instruction and faculty facilitation around relevant clinical applications of their learnings. We're only the 4th College of Medicine in the country to adopt this new way of teaching, and we have been able to implement it in record time, just 6 short months. We are already seeing tremendous impact from this program. The traditional discipline-based medical education model has had an 18 to 20% student failure rate in classes at a national level, and those same failure rates were noted here at Neomed. And these also show a similarly low performance on the national shelf exams. With this new teaching paradigm, student pass rates in knowledge mastery on standardized exams is already close to 100% at Neomed, something that has been seen at other institutions who've been groundbreaking in this area. This is a better way of teaching and a better way of learning. In spite of the pandemic, our College of Pharmacy has continued to excel under Dr. Kasmer's leadership. We've grown to about 90 students per class and have created a system of constant curricular improvement to meet the changing needs of our students and the field of pharmacy practice. Although a relatively new college, the College of Pharmacy has had incredible successes. Annual student surveys show near unanimous praise for the quality of the programs, the quality of the faculty, and the quality of the education. We have a 94% graduation rate and a 94% first-time NAPLEX pass rate, well above the 88% national average. And while US News and World Report ranks this new college in about the 50th percentile, national experts using more appropriate ranking criteria have published that Neomed College of Pharmacy should be listed as number 12 in the nation, placing it in the top 9% of pharmacy colleges in the US. Under the leadership of Dr. Schmidt, our College of Graduate Studies continues to grow and offer outstanding programs in multiple graduate fields of studies at the master's and doctoral level. We have 9 degrees and graduate certificate programs, including a Master's of Public Health, Master's of Medical Humanities, Master's of Modern Anatomical Sciences, and PhD in Biomedical Sciences and Integrated Pharmaceutical Sciences. And we just received Board of Trustee approval to create a new Master's in Certified Anesthesia Assistant program and a new Master's in Health Systems Management and Leadership. So things are continuing to move forward at this university despite the pandemic, all because of the capabilities of our incredible faculty and staff. We are here to serve our students. We underwent redevelopment of our strategic plan in February of this year that has now been approved by the Board of Trustees as of September 9th. The plan provides a roadmap for our future and guides how we invest in smart growth, program development, and partnerships. This was a robust and inclusive process that engaged over 300 team members and community partners. 48% of our working group team members were Neomed faculty, with substantial representation on each of the pillar development teams, because I am absolutely committed to shared governance. Our faculty are the driving force for the research and the education that takes place on this campus, which is the key elements of our mission. And our staff are the key facilitators to making sure that we do this in an outstanding fashion. Just to emphasize what I've shared with you before, it's important that we all know our mission, our vision, and our values. So our new mission, Neomed harnesses diversity, innovation, and collaboration to create transformative leaders and improve health through education, discovery, and service. Our vision, to be the model of excellence in innovative education and impactful research to create transformational healthcare leaders of tomorrow. And our values spell out the term leader: leadership, excellence, advocacy, diversity, equity, and respect. We should all know those and memorize those, and it should not be difficult to do, because it really is the way we run this university. It should be part and parcel of everything we do. Our 5 pillars, focusing on leading people, leading at all levels; education, leading and learning; discovery, leading with inquiry; community, leading with others; and growth, leading future opportunities. In line with the new strategic plan, we have a strong focus on diversity initiatives, leadership skills, the exceptional student experience, and development of a new faculty practice plan with focus on integrated primary care and behavioral health models, expansion of our successful SOAR clinic, and development of a substance abuse and opioid addiction clinic. All of these are mission aligned, and all of these also offer us the opportunity to improve education and to improve research, specifically in these areas. We are focusing on growth and innovation, translational research, and entrepreneurial activities to improve healthcare through technology development. And we are investing in our team and our partners through faculty and staff development, with expansion of our new Lean Six Sigma initiatives and new research programs, as well as support for those programs through faculty development in the areas of research, education, leadership, and excellence in clinical education. Our commitment to diversity has been renewed. We are now focusing on better ways to ensure that we have diversity, equity, and inclusion on this campus. Our initial diversity target is based on that of the state. About 18% of our population should be underrepresented minorities. Our current status is not where we need to be. We're at 12.8% with our students. Where should we be? Well, we serve Northeast Ohio. Youngstown is 50% underrepresented minorities. Cleveland, over 50%. And Akron, about 30%. I would argue 18% is not enough, and we will shoot for that as our initial target, but we've engaged others to come in and help us better understand what our target should be and find best ways for us to achieve that. We have new initiatives in place. The great work of our team putting together the Modern Anatomical Sciences program has really highlighted what we can do. A focus on improving equity, diversity, and inclusion. They've been able to achieve nearly 80% of their student population is falling into the category of underrepresented minorities, helping us to promote pathways for them into healthcare. We put together a President's Advisory Council from leaders externally, many of whom are our graduates, our alumni, helping to provide oversight to what we're doing and sharing with us ways that we could do it better. We have increased scholarships, and we are changing our partnership institution allocations in ways to better enhance our diversity on this campus. I really would like to recognize the outstanding work of Mr. Jim Tressel, the president of Youngstown State, who heard about our diversity issues and how our partners really contributed to the problems that we have by providing us very small numbers of diversity. And he has stepped up to now create 6 full ride scholarships, room, board, tuition, and books for 6 underrepresented minority students who want to go into medicine and track directly into Neomed. Really a wonderful thank you for this wonderful contribution from for Mr. Jim Tressel. He certainly comes across as Dr. Jim Tressel, an amazing leader. We also have new scholarships in the College of Medicine to assist low-resourced students. Our mission and vision focus on creating transformational healthcare leaders at every level, and it's more than just a statement of hope. The theme of leadership is woven into the fabric of our plan and to the fabric of our organization, and we are launching new initiatives to support our strategic plan. Neomed has a history of developing a disproportionate share of healthcare leaders and faculty leaders in the basic sciences. To date, this has been an unintentional product of the culture and training that we deliver at this institution. As a key part of our new strategic plan, we are focusing on developing our brand as a place that creates leaders. This is a very intentional and strategic approach to create leadership training programs for students at all levels. We are launching 2 programs immediately, seeking accreditation for a new 5-year physician leadership pathway for those who want to transform healthcare and not only understand the basic science and its applications to clinical care, but also understand leadership and business of medicine. Also, a new healthcare leadership speaker series, Vitals, Visionary Health Leadership in Action, is a program created to enliven the discourse, scholarship, and action surrounding healthcare transformation by showcasing the wisdom and experience of innovative leaders in the medical sector. Vitals will leverage the infrastructure of the new master's program and help build upon its capabilities and help to build our brand. In alignment with our strategic plan, we recognize that our people are our most valuable resource, and we are dedicated to their development and to making Neomed a great place to work. Nurturing the relationship requires communication, transparency, and the development of trust. I've been working since my arrival to help build trust between the administration and all employees at every level, and I hope that it is working. I've implemented several areas of change in this area, and I have more to announce today. As mentioned, we have resourced new faculty and staff development programs. We'll roll out the details of the new faculty development program within the next few weeks, but have transformed it so it is now under the Vice President of Academic Affairs and provided financial resources to ensure that it is a high value and impactful program to address the needs of all of our faculty at the same time that we are growing new development programs to enhance the development and capabilities of our staff. We have created the Lean Six Sigma Certificate Training Program and are empowering our team members at every level to implement change. We're just about to enroll our 4th full curricular course in this, with those who've gone through this already finding huge value in the program and empowering them to do things differently. We have created the new flexible work hours program. The first stage of that program was centered around hours flexibility, the second stage around teleworking flexibility. We have just completed a staff compensation study with Milliman. The results show that we are close to where we should be relative to the market but not quite there. About 10% of our employees are below market rate, and we will phase in adjustments to these populations to ensure that the positions are corrected over a short course of time. The good news is 90% of our employees are paid appropriately relative to our peer group or to the market that they compare us to. We are working on a new opt-in faculty compensation plan that will be sent out for review soon. For consideration by our faculty. Nothing to be forced on anybody, but merely an opportunity to do things better if faculty choose to be part of that plan. We are building new health and wellness green space along Talmadge Road, an opportunity for those on campus to find a place to help support their social needs and their wellness needs. Thank you to Jerry Bergstrom and the grounds crew who have been working very hard on seeding that area so that it will be available for use this coming spring. And now I'm pleased to announce a few new items that we have put into place in order to really resource, empower, and grow and recognize our employees, our faculty, and our staff. I noted that when I first started, we had a $1.5 million shortfall in funding of our health plan. That resulted in a sharing of those losses. We raised the amount that employees contributed to their healthcare benefits by necessity. But at that time, I promised to look for a better healthcare solution. It took some time, but I'm very pleased to announce today that we are implementing that new solution as of January 1st. We are switching from being a self-insured organization with the risks of overspending due to outliers within those who are covered by the plan to now a new fully insured plan. Our new plan that, as I noted, would begin January 2021 will be with SummaCare. Now, this is always a concern when you change the way a benefit is delivered, but I want to assure you that this is not going to have negative impact. It will have a great deal of positive impact. It will provide the same level of coverage through health benefits that we currently have now, but it's going to provide better pharmaceutical benefits to our employees. It will provide nearly the same network. In fact, our benefits consultant team stated that it is 99.7% the same network of providers that you are already seeing. The key is it is going to reduce the cost of the premiums. Our partnership with Summa Healthcare over these large number of years that we've been together has resulted in them stepping up to give us a rate that is far below that which most individuals have the opportunity to see. In fact, depending on the level of coverage that an employee has elected, whether it's single, employee plus spouse, or full family, it will reduce employee contributions anywhere between $350 and $1,880 per year. That's your contributions. So I hope you see this as me keeping that promise that we did find a healthcare benefit that gives you the same level of benefits, but improved pharmaceutical coverage with essentially the same network, but you are going to reap the rewards of savings. I'm also pleased to announce that as a thank you for your incredible efforts in helping us successfully persevere through these very difficult times, we'll provide 4 additional winter break days of leave as we have in the past, in addition to the 3 scheduled holidays for winter break. I also want to thank all of you for supporting the needs of the university and helping us with changes to support our continued success, even in these difficult economic times. Although more difficult times may be ahead, depending on the course of the pandemic and depending on the state of the economic status of Ohio, the changes we have put in place, including the cost savings around healthcare benefits, will allow us to provide an across the board 1% increase to base pay for all employees beginning January 1st. While it is less than we would have hoped to do before the pandemic hit, given that the pandemic is here and the economic impact has been greatly felt by the university, it's certainly more than we thought we could do just a month ago. And it's important recognition for your efforts and your dedication to Neomed. Even during the pandemic and the reductions in state support, our research enterprise continues to thrive. Our partnership with health systems remains strong, and our enrollment at Neomed is growing, something other universities in this state cannot boast. The ability to do this is not luck. It is due to the outstanding faculty and staff we have at this institution, and your dedication and your drive to support our mission. It is due to the support and guidance that we receive from our board of trustees and from that of our community partners. And we are continuing to push forward for growth that gets us to attain our new vision. And with that, I would like to break and offer you an opportunity to ask questions.
The first question we have today is why, after the implementation of new work from home policy, we still have individuals working from home 5 days a week?
So I don't know an answer to that. To be honest, this was brought to my attention just on Friday. And I had a long conversation with Andre Burton, our VP for HR, and I met with our leadership team from the executive management team this morning and brought this topic up. I can not at this time confirm that that has been happening, but I have been told that it may be happening. So we are looking into this, and all of the leadership have been told that it is their duty to ensure that we have fair and equitable allocation of this resource, which is the ability to de-densify our campus and give people flexibility around their life schedules through this opportunity. So I'm holding our leadership team accountable for ensuring that we have fair and equitable use of this program, and we'll continue to follow up on that. I'm sorry I don't have a better answer for you because I was not aware that this may be happening until my meeting on Friday with Mr. Burton.
Just a general announcement, AHEC will be assisting underrepresented minorities in underserved areas by paying for the MCAT prep. Preference will be for students who are interested in attending Neomed.
That's wonderful. Thank you for sharing that.
Another question, based on the discussion of the mission and vision, will there be any focus by university leadership on the sustainability and lowering Neomed's carbon footprint, considering the public health efforts of climate change?
That's always something that is on the back of our minds, and it's the right thing to do when we can do it and it's economically feasible. So the short answer is yes. How that fits into our strategic plan will be determined on what we actually do through our plan. So as we look at opportunities to reduce costs and move to different types of power that are green, as we build buildings and ensure that those buildings are also green, ideally at the platinum, if not at the gold and silver level, will be key ways for us to contribute to that.
The next question is about the healthcare with SUMA. I'm going to try to envelope this all together, but will coverage be provided in Akron, Youngstown, Canton?
So we looked at the coverage before we even laid any consideration to this opportunity. And we've been assured that the coverage is across the state of Ohio, either through SUMA, SUMA's partners, including UH, Cleveland Clinic, and it's also through Premier Network. So yes, it covers all of Northeast Ohio, and in fact, Ohio, and the coverage is 99.7%, according to our consultant, the same as the coverage that we currently have, meaning the network. Now, I do know there are some nuances to it. For instance, because it's through SUMA Care, if you're in Akron, then my understanding is Cleveland Clinic Akron is not covered, that you would need to see a provider through SUMA. However, it is covered in much of the rest of the state, including the Cleveland area.
The next question is, how will the randomization work for employees pulled for COVID test? Which tests will be used? Who will be maintaining the records containing the results? How will privacy be protected? And how will positive results be handled?
So that is still being worked out. We just received the information that we need to do this, and we're working with the Portage County Health District to implement. So this is not something that would go into an electronic health record or a paper health record for you, as we are not a HIPAA entity right now, and we are not maintaining healthcare records on our faculty, our staff, and our students. This is something that would be reported to the county, as all types of screening tests are. And you, the individual, would be informed. And any records that we keep would be protected information for being able to deal with a public health crisis, not a treatment record for you as an individual. We're looking at what types of testing are available. Many of you know there's PCR-based testing, antigen-based testing. Sampling can come from the nasal cavity, usually a nasal pharyngeal swab. It can also come from spit testing or saliva testing, but we don't know yet which of these are available to us, and we're working with our partners to try and get this implemented, as well as with the state to see if they will provide additional testing support for us. So we have these to work out. And as soon as we have that information, we will release it to everybody. I just wanted to get this out to you so that you know it's coming. Many of you keep up with the governor's updates, and in the governor's last update, he indicated that he is having higher education institutions do this.
Can you be more specific on the dates for the winter break?
Oh, there will be a document going out or an email going out immediately after this update today from the president's office, laying out the exact dates for you. But like in the past, it's been created to be able to cover a period of time along with the holidays, so that if you wish to supplement either through your vacation or through comp days, that we are encouraging a significant reduction on this campus of any footprint of employees or students.
Will the health benefits allow for a HSA or just a flex spending use it or lose it plan?
I don't know the answer to that. My understanding is that we are not changing what we are currently doing, but we'll get that information out for you. I'm sorry, I'm not prepared to give you the answer on that. Mr. Burton, if you could throw that into the chat box, that might be helpful.
Regarding SUMA, what about dependents who live outside of state?
Pardon me? One more time.
In regards to the SUMA plan, what about dependents who live out of state?
Well, it'll fall within potentially an out-of-network opportunity or potentially in-network, depending on that network's scale, and we'll get that out also to you through SUMA Healthcare. But the intent here was that we are taking care of our employees here in Ohio, and this does have a very robust Ohio coverage, and there is also out-of-network coverage outside of Ohio.
Is there a reason exams for students cannot be online at this time? I know a lot of people have been wondering the same thing.
I will have to leave that to our deans. This same question was given to me about 2 weeks ago. And during that update, I noted that the deans were individually in charge of how they were managing the testing within their colleges. And I'm going to continue to allow them to do that and to allow them to convey that messaging to their constituencies.
There are no further questions.
Great. Well, thank you, everybody, for this opportunity. It's been a pleasure to be able to serve you for the last year, and I look forward to many more together as we continue to grow Neomed to its full potential.